Hi there, I'm Alex from the Medical News Bulletin, bringing you the biggest medical news of the week. Visit our website, www.medicalnewsbulletin.com, for daily updates. You can find the link at the bottom of the screen. Today, we will be talking about rising summer temperatures and increasing death rates, traumatic brain injuries, artificial lights and their impact on our health, which types of fats are known to increase the risk of death, and stress and breast cancer risk. So let's get started. Summer is here in full swing, and climate change is slowly increasing global temperatures. With that in mind, researchers from Harvard University have looked at how increasing summer temperatures are impacting our health. They found that a 1 degree Celsius increase in summer mean temperature is linked to a 2.5% increase in death rate for seniors in the southeast U.S. A 1 degree Celsius increase in winter mean temperature was associated with a 1.5% decrease in death rate. Last year was America's warmest summer on record, so it's all the more important to make sure that you stay hydrated, cool, and protected from the sun this summer. The CDC estimates that over 1.3 million Americans seek emergency care for traumatic brain injuries every year. While most of these injuries are mild and people do return to their normal level of functioning, a new study shows that this may not be the case for every brain injury. Researchers have found that a single blow to the head, causing a loss of consciousness for more than 1 hour, puts someone at a 3 times increased risk of Parkinson's disease later in life. Even those in their 20s at the time of brain injury were at risk of developing Parkinson's decades later. Our circadian rhythms, mental, behavioral, and physical changes that follow a roughly 24-hour cycle, respond largely to light and darkness in our environment. Previous studies have shown that the persistent use of artificial lighting, especially during the night, disrupts our circadian rhythms and can be harmful to our health. Following a 26-week mouse study, researchers suggest that long-term exposure to artificial light impairs circadian rhythm, causing a reduction in immune function, bone structure, and muscle strength. Because 75% of the world's population is exposed to artificial light during the night, these results have huge impact on worldwide health and show that a clear environmental light-dark cycle is important to stay healthy. The word fat often comes with negative connotations, but when it comes to dietary fats, the fats found in food, certain fats can actually be healthy. Because different types of fats have different impacts on health, it's hard to know which ones to avoid and which ones to eat. A new U.S. study is helping make the distinction between different types of fats a little easier to understand. Following this 32-year study, researchers have found that higher intakes of saturated and trans fats were associated with an increased risk of death, while higher intakes of monounsaturated and polyunsaturated fats were associated with a lower risk of death. Many factors are linked to an increased risk of breast cancer: an older age, starting menstruation before 12 years old, being overweight, drinking alcohol, and even birth control use. Stress has been suggested as a factor for increasing breast cancer, but there's much debate over this claim. A new UK study has shown that, despite controversies, there's no link between stress and breast cancer risk. Following over 100,000 women, researchers took note of stressful events and medical records and found that being stressed does not increase the risk of breast cancer. That's it for today. Thank you for joining the Medical News Bulletin. We hope you enjoyed hearing about the latest health news.